Hello, my name is Imad Absah. I'm a pediatric gastroenterologist at the Mayo Clinic campus in Rochester, Minnesota. I have special interest in managing patients with celiac disease and gluten-related disorders. Celiac disease is a very common. It is an autoimmune disorder, so it is not an allergic reaction. Patients with celiac disease cannot consume gluten, and gluten is the protein component of the wheat. And usually the consumption of gluten would result in an autoimmune activation, and this activation would result in an inflammatory cascade that would result in a damage in the small intestine, which will lead to malabsorption and other common manifestations of celiac disease. Celiac disease is more prevalent compared to 10 or 20 years ago, and this is multifactorial. More commonly that we are more aware of it, we think more of celiac disease than what we've done before. We do understand that celiac disease can be asymptomatic, or patients can have atypical symptoms, so not necessarily they need to have bad diarrhea or lose weight or severe abdominal pain. They can have very non-specific symptoms like poor teeth enamel, headache, recurrent oral ulcers, or constipation even. So physicians are more aware of celiac disease, so we are testing more for celiac disease. Also, we have better testing techniques. Our blood tests or serologic markers now are very sensitive compared to what was available maybe 10 or 20 years ago. So we are able to detect celiac disease sooner than what we used to do 10 or 20 years ago, and we have more accurate testing that will identify the patients and help manage them. Our celiac clinic is a multidisciplinary clinic. We usually start by reviewing the medical records for the patients who are coming to the Mayo Clinic, and we try to pre-set and pre-schedule the appointments and the visits prior to their visit so they can get everything done in a short and efficient time. Usually the visit will include meeting with a physician, and then after meeting with the physician, there'll be a meeting with a pediatric gastroenterology nurse who is very interested and experienced with celiac disease. Also go over the specifics of long-term planning and management, and over the questions that the family has, and that nurse usually works as a very good connection between the family and the physician and try to troubleshoot and answer many questions.